What do you understand by stroke? When somebody says, oh, he has stroke, she has stroke, what do you think happened? So, in the brain, there are blood vessels that supply the brain with oxygen and nutrients. So, for whatever reason, when that blood supply is no longer there, maybe that artery is blocked, or so it has busted for whatever reason, and then there is bleeding that will reduce or stop the complete flow of blood to the blood cells, to the brain, and then stroke happens. Stroke is a medical emergency and needs urgent attention. There are three types of stroke, common type of stroke that we see. One is the one called ischemic stroke, and it's usually due to blockage, and it's most common. It's the most common type of stroke we see. Sometimes some of the fatty food we eat that deposit on the walls of the arteries and the blood vessels. So sometimes they can block the blood vessels that take blood and oxygen to the brain, and the brain will no longer receive that oxygen. What happens to the brain? It starts dying. Also, high blood pressure, diabetes, high cholesterol, these are some of the things also that can cause this type of blockage. And the brain will not receive food and oxygen again, and the brain dies. That is stroke happening. Another type of stroke that we see is called the hemorrhagic stroke. Just as the name implies, hemorrhage means bleeding. So sometimes the vessels that supply the brain might get weak, maybe due to high blood pressure or what they call brain aneurysm. So whatever reason, when they get weak and they burst, then bleeding starts happening. It will reduce or minimize the amount of blood and oxygen that goes to the brain, and then the person suffers stroke. Another type of stroke we see is what they call mini stroke, or TIA, transient ischemic stroke attack. Okay, the mini stroke, that's what we usually call it. So sometimes it's just a temporary block of the flow of oxygen or blood to the brain. So sometimes when it happens, there's a tendency that the full stroke is going to happen. So we keep an eye, try to adjust lifestyle, food and whatever, just to see if we can prevent the occurrence of the full stroke. There are some signs of stroke that all of us need to know. So we usually go with we usually use the FAST rule, FAST, the FAST rule. So when the first thing is F, which means face dropping. When you are with somebody maybe you're playing, watching TV, watching football or whatever, and then you're looking at somebody's face, and one side of the face starts dropping, one feeling numb, the person can say, oh, I can't feel this side of the face again, and maybe it's dropping lower than the other side of the face. Suspect stroke. Another one is arm, which represents arm weakness. Sometimes the person might not be able to lift one of the hands properly. You can ask them to lift the two hands, and one will lift properly, and the other one, you'll be dragging the other one. Suspect stroke. Stroke might be happening to that person. Another one is speech difficulty, for S. Speech, the person that might be slurred speech. Maybe the person cannot repeat sentences, cannot speak very well. Suspect stroke. Stroke might be happening to that person. And then T means that is the time to call for help. Call for emergency. Send that person immediately to hospital if there is no ambulance to call, depending on the country and where you are. Other signs of stroke that we might see might be sudden confusion. Maybe the person might have difficult understanding thing or remembering thing, or you're telling that person one thing and he's saying another thing. Confusion from nowhere. Suspect, is this person having stroke? Look at other signs like the fast that we mentioned. If you see any of them, just suspect it and start calling for help. It's a medical emergency. Another person is, the person might have trouble seeing with one eye or both eyes. One eye or both eyes. You know, stroke might be happening to that person. Sometimes there might be terrible headache of non cause. The person wouldn't know where the headache is. All of a sudden you're having a severe headache. Check if when there is a combination of 1, 2, 3 of these signs. So just suspect that maybe stroke might be happening. Go to hospital first and allow the doctors there to tell you whether it is stroke or not. Another thing is that the person might lose balance or have trouble walking around. They are all signs of stroke that you might see. Okay, so but who is at risk of stroke? Actually, everybody is at risk of stroke. But some of the risk factors, or those who are mostly at risk, are those with very high blood pressure, those who smoke, those with diabetes, high cholesterol, obesity, those that don't do exercise, like lack of exercise, those with heart diseases, excess alcohol intake, and some family history of stroke. These are some of the causes of stroke. So, and because stroke sometimes is still due to lifestyle, that is when the question of what do we do to reduce the occurrence of stroke. There should be control checking of our blood pressure regularly. Check if it's high, please go to the doctor, take medication to put it under control. Eat healthy. Let's eat less of salt, sugar, fried food. More vegetable and fruit will always do us good any day, anytime. And then we try to exercise regularly. Maybe 30 minutes a day is a good exercise. We can try whatever we can to stop smoking. I know it's difficult, so but we can start reducing the number of sticks we take a day. We can limit the amount of alcohol we take on daily basis, on weekly basis. We try to manage our diabetes, the blood sugar. We try to keep it under control and take our prescribed medication. Those who have heart conditions, cholesterol, high blood pressure, if you're on any medication, please try to take them as prescribed. So when you suspect stroke, what do? Just call emergency, call ambulance service immediately. If there is no ambulance, arrange transport and send that person to hospital. Try to calm the person down and put them in a safe position, because they are scared. They don't know what is happening to them. So try to reassure them and say, maybe you're having stroke, I'm not sure, let's get you to hospital. Okay, and when this happens, please do not give the person any food or drink or medicine. Don't, because they might choke. And then you check for breathing. If for any reason they have stopped breathing, please start your CPR if you are trained. In the next video, we are going to talk about CPR. Everybody, including children, should know how to do CPR, because that thing is a life saver. I mean, to some degree, it can buy that person time until the medical people come to take over. And then note the symptoms. Just try to tell the doctors what has happened. What did you notice? How did this happen? Because the person in question might be confused and might not remember anything. So you are very, very instrumental in giving the doctors at least tell them what happened, so they can pick up from there without them guessing, oh, where could this person be? At least you can solve some of those problems by telling the doctors what you know about that. I hope this short video is just to summarize a little bit of what stroke is. In our next video, we will talk about CPR, how to do CPR, and of course heart attack and CPR. Thank you for watching video, and I will see you again in my next video. Please, let's keep healthy together, let's eat healthy, and let's live longer.